So let's talk about the Dutch test. What specifically is that? I get questions quite often on the Dutch test, or I get questions on, how do I test my hormones? And, there's three different ways that I can think of right off the top of my head. And that's serum or blood, and then saliva, and then urine, which is a Dutch test. Go into the Dutch test.
Sure. So, we'll of course look at all of those modalities. We find that blood testing is probably the least reliable when you're looking at long-term hormonal symptoms, just because it's a one-time snapshot. We do love saliva testing as well. Dried urine test for comprehensive hormones. That's what Dutch test stands for. You can use it even if you're not Dutch. And the Dutch test, is collecting 24 hours worth of urine. So we're looking at metabolites of a lot of the hormones in the body. The reason I love urine testing is because, we're looking at a lot of steroid hormones, sex hormones. Those are bound up, a lot of them, in our fat tissue. And so if you're looking at a serum test only, you're looking at levels of hormones that are in the blood at any given time. It's not giving the right picture, the correct picture of especially estrogen, estradiol, which again is bound up in our fat tissue. It has a cholesterol backbone. It is a sex hormone. So thereby, it's got a fat backbone. So it likes to sequester itself, kind of hide itself in our fat. And for a lot of women, they're nodding. They're like, well, I got plenty of that then, right? And
right.
It's kind of true. So we do see an incongruency when we're testing, looking for estradiol levels and testing blood or serum versus urine. I tend to see on the Dutch test much higher levels of E2 or estradiol than I do on serum, because it's a more, a deeper look, a better picture of true estrogen levels. Now, the Dutch test doesn't just test estradiol. It also tests the other two estrogens we have in our body. So E1 or estrone, E3, estriol. So women don't just have one kind of estrogen. There are three different types, and those estrogens can all interconvert right into each other. And we look at a couple different pictures specifically with estrogen on the Dutch. Estradiol is the strongest and most abundant estrogen in the body. So it's going to do the most work at the heavy lifting. Estrone is mostly made in our fat tissue, and it's a weaker and less abundant estrogen. And then estriol, is a lot of what we play around with as functional diagnostic nutrition practitioners. It's E3. And again, it's a little bit less abundant and a little bit less maybe forceful in how it works in the body. Estriol, I really like too, because it tends to be a really indicative of what's going on in our gut health. And we can talk about that later on too, that, as FDNs, we are looking at gut health for our clients as well, not just hormones. Okay, so that was a long explanation, but let me be really clear. The Dutch test looks for estrogen, testosterone, progesterone, cortisol, adrenaline, melatonin, DHEA, and then an array of organic acids, including B12, B6, biotin, glutathione, a marker for neuroinflammation, quinolinate, and dopamine and serotonin. So kind of precursors to some of those neurotransmitters. I'm probably leaving one or two out, but it's 7 a.m. So that's why. But it's a really comprehensive test that gives us a full picture of what a woman's hormones are looking like, again, over a nice 24-hour period of time. We test at day 19 or day 20. So you're fully into the luteal phase when progesterone levels are theoretically the highest. And that's one of the most important markers that we're looking at, especially for PMS when we're running the Dutch test.